Hello, I'm Dr. Joseph Webb, CEO of Nashville General Hospital. It's my pleasure to welcome you to our 2021 virtual town hall. Thank you for taking the time to attend this event. I will begin with some key recognitions. First, our dedicated staff who have consistently demonstrated resiliency and compassion. The Hospital Authority Board of Directors, our partner, Meharry Medical College, the Honorable Mayor John Cooper and his staff, and Metro City Council members. There's no doubt that Nashville General Hospital provides the highest quality of care regardless of a patient's ability to pay. I'm extremely proud of the outstanding accomplishments this team has made over the past 6 years. The positive outcomes have resulted not just for Nashville General and our patients, but also for the city of Nashville. I know many of you are already a part of the Nashville General Hospital family and others who are familiar with the hospital, and then there are some who may not have ever set foot in the doors to receive care from this amazing team. For the latter group, here's what you need to know. At Nashville General Hospital, the patient always comes first, from chronic disease prevention and management to the food pharmacy's tornado relief efforts and combating COVID-19 pandemic. Nashville General has remained committed to being a patient-centered healthcare delivery system. Tonight, you will hear from some of our team members who will explain what that means and why it represents the foundation of quality of care we provide. Here's a preview of this year's highlights. Nashville General Hospital continues to expand its care delivery by recruiting dynamic, board-certified physicians from across the nation. These providers have chosen to join our team and contribute their expertise to caring for our patients who are Nashvillians. Last year, we launched our first off-site clinic, Nashville Healthcare Center at Midtown. This year, the clinic is meeting its volume goals and improving patient health outcomes. Although there has not been a need to activate it yet, thankfully, Nashville General was selected by Governor Lee and the Tennessee Department of Health as Middle Tennessee's alternate care site for low acuity COVID-19 patients. Our Congregational Health and Education Network, CHIN, a faith-based initiative, was awarded federal 501c3 tax-exempt status, which will allow CHIN to have a greater impact in the community with executing its mission to reduce health disparities. We continue to execute the strategic goal of diversifying our patient-payer mix, which subsequently leads to a reduction in the Nashville taxpayers' burden to subsidize the hospital's operations. A focus on service and quality, we added key strategic positions to our leadership team: a Senior Director of Quality, Director of Customer Experience, and Chief Marketing Officer, to name a few. We represented the city of Nashville and Nashville General Hospital in a presentation before a national audience. America's Essential Hospitals hosted the presentation on improving clinical outcomes through population health management. Before we hear more about these accomplishments, please join me in welcoming a few of our esteemed council members. Councilmember at Large Sharon Hurt and Metro Health and Hospital Committee Chair and Co-Chair Brandon Taylor and Jenny Welch. Councilman Taylor.
Hello and good evening. I am Metro Nashville Davidson County Council Member Brandon Taylor, Chair of the Health, Hospitals, and Social Services Committee. I'd like to thank my fellow council members, Nashville General Hospital staff, Metro Hospital Authority Board, and members of the public who have joined us today. Nashville General Hospital is essential to Nashville-Davidson County as they have maintained their strong commitment to addressing the healthcare needs of all Nashvillians, regardless of their ability to pay, from across Davidson County. Also, in fulfillment of their mission, Nashville General Hospital was honored to serve as the index hospital for Meharry Medical College, one of the nation's oldest and largest historically Black academic health science centers. As the council representative for District 21, North Nashville, I am proud to have both Nashville General and Meharry Medical College in my district. These two institutions hold not only historical significance to the North Nashville community, but to the city and the nation. I support Nashville General Hospital's leadership in doing their due diligence in planning for the future and I am excited about the opportunities that may present themselves to the city's original community hospital and the continued care for our residents. Nashville General Hospital truly serves as an enduring symbol of hope, care, and compassion in the community and is the epitome of Nashville Strong. With that, let's hear from my co-chair, Councilmember Jenny Welsh. Jenny?
Thank you, Councilman Taylor. Hello, I'm District 16 Councilmember Jenny Welsh. I serve as the co-chair of the Health and Hospital Committee. Nashville General Hospital's mission is to improve the health and wellness of Nashville by providing equitable access to coordinated, patient-centered care. Their vision is to provide exceptional and compassionate health care, one neighbor at a time. As a Metro Council member, I'd like to take a moment to boast about Nashville's Metro Employee Incentive Program. It eliminates the costs for copays and deductibles for primary, specialty lab, or emergency healthcare services provided at Nashville General Hospital or Nashville Healthcare Center, better known as the NHC Clinic. It's for all Metro employees, pensioners, and their dependents who are covered under a Metro medical plan. There is zero cost to participate in the Metro Healthcare Incentive Program, and there's no sign-up needed. If you currently have a Metro Healthcare plan, you're eligible now. And I can tell you from personal experience, the cost savings and the quality of care are fantastic. My first child was born 32 years ago, and I had all my prenatal care here. I've recently had surgery here. My husband had surgery here. I get all my mammograms and all our preventive care here. The doctors, the nurses, the staff are incredible. They make you feel welcome. They answer your questions. They make you feel like you're in good hands. I recommend Nashville General Hospital and the Nashville Healthcare Clinic to everyone. I don't think people realize the jewel we have in this system. So please take advantage of it. Come in and see for yourself the quality of care that we provide at such a low cost to you.
Nashville General Hospital has been providing compassionate care for this city for 130 years. We are fortunate to have a healthcare institution like Nashville General that we can call our own. I have been a proponent of the hospital long before I became a council member. 36 years ago, I gave birth to my first child at Nashville General, and I have trusted them with my care and my family's care since then. During last year's town hall, I talked about teamwork and tenacity. Under the leadership of Nashville General CEO, Dr. Joseph Webb, the hospital has seen numerous advances in quality and safety and national recognition for their innovative approaches to patient care and integrated care delivery systems. Also, over the last 5 years, Nashville General Hospital has experienced an increase in clinical visits, hospital admissions, ER visits, and has successfully diversified their patient population by increasing commercial insured patient population. This is what we'd like to hear at Metro, and we are looking forward to what's in store for the next 5 years. Nashville General offers what people are looking for in healthcare, a commitment to providing exceptional care to Nashville without exceptions. As a trusted source of care, Nashville General Hospital improves the overall health of the city of Nashville with every patient they care for. Nashville General is an everyday hospital for everyday people. This is why it is imperative that we continue to share the good news about the hospital with our family members, co-workers, friends, and neighbors. I know I will, and I hope you will too. God bless.
Good evening. I'm Bruce Nairmore, the Chief Financial Officer for Nashville General Hospital. Thank you for taking the time to attend this virtual town hall event. When I arrived here 3 years ago, my mission was to organize and hardwire financial reporting processes, improve our revenue collection processes, reduce costs, clean up our annual audit, and rebuild confidence with Metro government finance and the council. Improving our financial position means getting paid properly and timely for the insured work we provide, strategically expanding service to insured populations, especially to Metro employees, Medicare members, and our TennCare members, thereby improving our patient payer mix. Having more insured patients allows us to continue to care for our safety net charity patients as required by Metro Charter. We have a patient-centered medical home approach for all patients, but especially for our safety net charity patients, we actively manage them from crises in the hospital and the emergency room to ambulatory approaches and interventions in our lower-cost clinics, rather than hospital episode crises, which are much more expensive. This improves long-term health and lowers the cost for others. Our other mission is keeping our costs as low as possible. Proper staffing ratios, reducing overtime and contract labor costs, and negotiating better supply and pharmacy costs through our group purchasing and bid efforts. We must remain competitive with wage rates for nursing, ancillary, and support staff. Contract labor is 3 times more expensive than our own employees, and the quality and continuity of care can be compromised. The goal is to continue to reduce our reliance on the Metro subsidy. It has dropped in each of the last 4 years from $48.1 million to $46.1 million, and then to $43.1 each of the last 2 years. It's not often that you hear costs are going down in healthcare. COVID-19 has completely disrupted healthcare workforces across the country, driving up wage rates, protective equipment costs, pharmacy costs, and greatly increasing premium pay costs and overtime and contract labor after we had 3 years of positive progress. Thankfully, we've been able to utilize some CARES Act funding to offset some of the extraordinary costs from staff outages, shortages, virus exposures, etc. So I just want to thank all of you for supporting our patients, your team members throughout this past year, and ask you to again raise your game as we've done over the last several years. Our patients, and indeed all of Nashville, are counting on you.
Good evening. My name is Dr. Deanne Bullock. I'm the Chief Medical Officer here at Nashville General Hospital. I want to thank you for taking a little bit of time out of your evening to spend with us to learn more about what we're doing here at Nashville General Hospital. I will talk to you about a few points that I really want to focus on. Number one, that being the physicians in the clinics. As we continue to grow and build, we want to make sure that our patients have access to all the care they need at one place. This eliminates them having fragmented care around the city and allows us to truly coordinate our patient care. We have built multiple service lines and grown each of these to maintain the needs of our patients. Most importantly, these have been orthopedic, general surgery, and our primary care practice. We currently have multiple different options for our patients here at the Nashville General Hospital main site, as well as our Charlotte clinic. As we continue to grow and build, our patients will have more additional options each and every month as we continue to build our service lines. We also want to talk about a little bit about COVID. All of us have been impacted by COVID over the last year, some more than others in many different ways. COVID has impacted our organization tremendously. As we continue to see the numbers of patients grow across the city, they continue to need inpatient care, outpatient care, emergency department care. We are well equipped at the Nashville General Hospital organization to maintain the needs of these patients. We are providing inpatient care for our patients that need ICU care, med-surg care, or just general follow-up from the clinics. As we continue to maintain our vaccination program, those will be options for our patients as well. We've also built the monoclonal antibody program for our patients to make accessible to patients that meet the eligibility criteria. As COVID continues to evolve, it will impact all of us in different ways. We continue to grow and adapt to meet the needs of our patients and those that are relying on us for their COVID care. We continue to be the academic teaching hospital of Meharry Medical College. We serve as the primary teaching location for their medical students and their residents. There are 4 primary residency programs that are housed at Nashville General Hospital, those being the internal medicine service, the family medicine service, the OBGYN service, and the psychiatry residency programs. Additionally, the Meharry Medical College Dental School is a partnership as well. We maintain be it teaching environments for their GPR residents, as well as their oral maxillofacial surgery residents. These provide opportunities for our patients and increase their access to care, and provides multiple options that other organizations may not be able to offer the patients. While doing all of this, we maintain our service and our quality standards that are needed for our organization to continue to maintain their Joint Commission accreditation. As we continue to grow, we want to make sure that you know that your needs will be taken care of, and that all of the services that we offer are available to all of those that need it, any time of the day or night, as long as you may need it. Thank you.
Good evening. I'm Dorothy Bennett, the Chief Ambulatory Services Officer for Nashville Healthcare Center, the clinical portion of Nashville General Hospital. Today, I'm going to be talking about the outcomes for the Nashville Healthcare Center and the clinics. The first one I want to talk about is the Emergency Severity Index. That is the lowest acuity patients that go into the ER. Our goal is to be less than 3%. About 6 months ago, we were at 5%. Today, we're at 1.2%. So that means only 1.2% of the patients going to the ER should have been seen in the clinic rather than the ER. The second one I want to talk about is hypertension. Any patient with a chronic disease of hypertension, we monitor, and 53% of our patients are in compliance with their blood pressures. We utilize the American Heart Association numbers, and 53% of our patients fall within the normal range. Diabetes, we have made a huge change this year. Last year, we were at 37% of our patients with a diagnosis of diabetes was in control. Right now, we have 45.4% of our patients in control with a diagnosis of diabetes. Mammograms is another one that we have totally improved upon for internal medicine. Last year, we were at 56% of our patients had gotten a screening mammogram. This year, we have 78% of our patients had a screening mammogram done this year. Depression screening is another one that I'm pretty proud of. 79.44% of our patients had a depression screening completed. With all of the things going on with the COVID-19 pandemic and the things in the world, depression has been a big issue for us with our patients, and that can affect all of their other chronic conditions. Volume is another one that I'm very, very proud of for the clinics. In 2018, we saw 30,568 patients. 2019, we saw 32,417. And in 2020, we saw 35,908 patients. That's up over 5,400 patients from 2018, something I'm very, very proud of. In 2021, our goal is to see 40,262 patients. At the rate we're going, we'll be able to do that without any problem. The next measure I want to talk about is our turnover rate. Heather, our Senior Director of Clinical Operations, and I monitor our staff, and we monitor how many leave and how many come. Our turnover rate now for the month of December was 1.16%. That's huge. And what that means to our patients, and we always try to put the patients at the center of our focus, what that means for our patients is that the same staff are here every time they come. When you have a large turnover rate, patients really don't even know who's going to be taking care of them or who's going to be seeing them, and they can't always relate to them. So when you have the same staff in the same clinics on an ongoing basis, they get to know them. So it's like old home week for them. So we want to make sure that our turnover rate is low. The last thing I want to talk about is one of the processes we recently put into place was cash collections. Our staff collected over $12,000 in the month of December for a partial month. And that is huge when you talk about our patient population and their ability to pay a copay or a deductible. So I'm very, very proud of our staff, and I'm very, very proud of the clinics. Thank you.
I'm Vernon Rose. I'm the Executive Director of the Nashville General Hospital Foundation, and I'm here to give you an update from our year of 2020. So we started last January, as we have each year for the last 3 years, providing food to patients through our food pharmacy. And our food pharmacy is unlike food pantries across our community in that patients that come are getting a specific diagnosis for their condition, and then we provide foods based on that. So hypertensive, diabetic, cancer patients are getting foods given to them that help them better self-manage their disease. But of course, with the tornado, and then pretty quickly thereafter, our COVID, everything shut down. So we had food on the shelves, but no patients because we were shutting down internally. So I worked with Reverend Fuzz in our community, and we found volunteers who were willing to come to our back door and get the same foods out to first our patients, and then it expanded rapidly to patients and individuals and neighbors and friends, people that were knocking on church doors that were closed because they didn't have enough to eat. So as of the end of December, we have delivered more than 200,000 meals out in our community. Every tote that goes out here delivers a minimum of 5 to 5.5 days of food. So that translates to over 200,000 meals that have been delivered across Davidson County since we started. In the meantime, when we started in the fall, we still needed to raise funds to support the food pharmacy. So we did 2 things. First was our Nurse the Heart campaign in honor of Reverend Fuzz, who was gracious enough to let us lend his voice to the community for folks to donate. And that had great matching funds with a huge payout of over $107,000. And at the end of the day, we were so glad to also continue our Project Warm project. So Project Warm, and this just came in today's mail, is where people in the community bring sweaters and socks and scarves for our patients. So at the end of February last year, we had more than 1,300 items donated, and every single one of them left before the end of winter last year. So we're doing this again this year. It's been a little more challenging because businesses are closed. It's not quite on people's minds as much, but we've gotten coats and blankets, and with this delivery today of socks. So I just want to thank everyone for a great year of support in 2020, and hoping everyone has had a safe start to 2021.
My name is Sue Fort White, and I'm the Executive Director of Our Kids. And for nearly 34 years, we have been considered an outpatient clinic of Nashville General Hospital. And we're really proud of that. Our Kids provides forensic medical evaluations and crisis counseling in response to child sexual abuse. We serve Davidson County, but we also serve 44 counties in Middle Tennessee. And we feature a multidisciplinary approach with nurse practitioners and social workers working with every single child and family that we evaluate. We have always been trauma informed. We've always integrated medical care and the best psychosocial care that the families and children really need. We could have never developed this excellent model without the steadfast support and encouragement of Nashville General Hospital. Another thing that's really important about us, because we're one of the largest clinics of our kind in the country in terms of patient volume, we feel an obligation to add knowledge and real content to our field. And so we have had 3 research projects published. The last one is an injury prevalence study published in the Journal of Pediatric and Adolescent Gynecology, which has also been recognized by the American Board of Obstetrics and Gynecology, and they recognize this article as like barrier breaking. So the fact that a small nonprofit and an outpatient clinic of Nashville General Hospital can become national leaders in the evaluation of child sexual abuse is a real source of pride for us, and we are so thankful to Dr. Joseph Webb and the leadership team and all of the team members at Nashville General Hospital. Thank you for making Our Kids who we are and what we are. We are very, very grateful.
I decided to come and work in Nashville General Hospital because the history of the hospital. The hospital has been here for many years, has been one of the important healthcare system down in Nashville. And also because I would like to move to Nashville.
I was in the process of completing my fellowship in Columbus, Ohio, in reconstructive foot and ankle surgery when I saw, and I was searching for jobs actively, pretty much anywhere. But when I saw the job pop up for Nashville General Hospital, of course it's Nashville, which is immediately grabbed my attention. It's a popping city for young professionals. And I went ahead and applied to the job, and fortunately, this was the first job offer that I received, and I couldn't pass it down.
I think working in Nashville General Hospital, the difference between this place and other places is the diversity. I'm myself a diverse person because I work in different continents. I'm a European original, I'm Italian as my training, and a lot, I speak different languages. I like the fact that here I can meet people from in a lot of different countries. And since I consider myself like a cultural sensitive person and I'm able to talk to different people in a different way, I feel very good here because I can talk to different races, different languages in their own way, because everybody has his own way to be talked to and they receive the message in a different way. So I really enjoy the diversity here, the fact I can see patients, sometimes from South Africa, sometimes from, South America, sometimes from here in Nashville, sometimes from California, sometimes from Europe, and that's been a quite exciting way to practice.
A lot of our patient population here, unfortunately, are indigent. They don't have any insurance. So that's the biggest benefit, is they're getting quality care despite their socioeconomic status. At Nashville General Hospital, we don't compromise care based on socioeconomic status.
We try to trim the care around the patient. That's why patient-centered healthcare means. So when they come in a hospital, we try to evaluate what the need of the patient. And because here we have different service, we can trim from a basic medicine, like internal medicine, family practice, to specialty medicine, like can be a surgery, can be rheumatology, urology, cardiology, and other. And I think that we are moving, and hopefully we move it to a module that we call a one-stop shop, where the patient can come in and hopefully get most of the care in the same place. And I think this will be the future of medicine.
Working through COVID as a physician here at Nashville General Hospital was interesting, to say the least. One thing that I can say is that the hospital really did everything to protect us as healthcare workers, interacting with patients on a day-to-day basis. Of course, I would be remiss to say I was infected with COVID at one point, and I probably got it through interaction here at the hospital, but the hospital was very supportive thereafter. But that being said, again, it was very different in terms of the interaction. You can't hug people as you would. If somebody's crying, you can't really come close to them and, pat them on their shoulder or anything like that. So that part was missing, but nonetheless, the patient care was the same. We just had to put on some stuff to protect ourselves.
October the 21st, my granddaughter presented symptoms of COVID. First, we kind of ignored it until she said that her eyeballs felt like they were about to come out, and she started to run a fever. So next day, we came to Meharry to test her, myself, her sister, and my other grandson. She was the only one at that particular time that tested positive for COVID. So we felt maybe we were in a good space. So we went home, quarantined, did everything that we were supposed to do. And then next day, we ran a fever. Their little brother, he didn't. We came back to test, and we all but him, and he's autistic, tested positive for COVID.
I was originally diagnosed on January 22nd with stage 4 cancer, melanoma that had metastasized from my back and spread to 10 other parts of my body. It's been quite a journey. I'm actually a living miracle, because in the beginning, the first doctor gave me 6 to 9 months without any good treatment.
Back in 2004, I had a real serious surgery. It wasn't here, but I lost one of my kidneys. So immediately, Dr. Romano got that team on board. They also were trying to protect the one kidney that I have left.
As the week progressed, they were getting better and I was getting worse. I called Dr. Fagan. She says, do you have something to check your levels with? My husband is a first responder, so he tested my oxygen levels and they were plummeting significantly. She says, I need you to go to the hospital. At that particular time, we were like, well, we'll just go, to one of the other hospitals. And she says, I need you to go to Nashville General. And we said, okay. And so she says, you'll get the best care there. I know the doctor's there. That's where you need to be. So my husband says, that's where she says go. That's where we're going. After that, the journey began. I came in, I had a temperature like everyone else. I had this excessive cough. I couldn't breathe at all.
At first, that day when I found out, I obviously had a very emotional moment for about an hour. Talked to my family, cried a lot, got mad a lot, and I actually had a hockey game that night. I contacted my team, and I didn't know they were going to do this, but they rallied a bunch of my hockey community friends, and at the game that night, I had a cheering section of my own. They brought signs and everything, and it was kind of hard at first, but I scored a goal, and when I scored that first goal, I skated back to the bench, sat down, kind of buried my face inside my jersey, and I just let it all out, and decided I'm not going to let this beat me. I'm not going to curl up in a corner and wait to die. I'm going to keep living.
I don't remember a lot because I was kind of like in and out. But the one thing that I can say is the care that I got from the people here was extraordinary. I've been in the hospital before, but I had never been where everybody treated you like you were a part of their family. And that's how I felt when I was here at Nashville General, like I was part of the family.
They initially wanted to do surgery, and as quickly as it had spread, they decided we just need to attack it all now, and with immunotherapy. Each treatment, I was seeing changes, good changes. And I was waiting for the side effects to hit, and I never really had any. I mean, I've heard side effects of low energy, tired all the time, no appetite. From the way TV shows and everybody portrays that you're supposed to look and feel miserable. I've never felt like I've had cancer. It's not been a painful journey for me. That's why I say I'm a living miracle, because all the things that I should feel and experience, I'm not. And yet I'm getting better.
It was a big relief knowing that I could get care and not have to worry about the medications. I didn't have to worry about being seen. I didn't have to worry about anything. And it seems like I got the best people on board. I do. The kidney doctor, the neurologist, the wing that they are now calling Dr. Robert Harding. I have the best people on board.
You hear things, your community hospital, and I don't know why people wouldn't want to come here. But I don't know why people would not want to. The staff, the doctors, the nurses were extraordinary. I had my own room. I wasn't in a hallway. I wasn't treated like cattle. I had my own shower. It was like being sick in a 5-star hotel. They gave me the best care that anyone could ask for, or not ask for. I think Nashville General staff is not the exception, they're the rule. I don't think that my journey here was different from anybody else's journey that's been here.
I actually look forward to coming for my treatments, which a lot of people would think that's insane. They make me feel so comfortable. The nursing staff back in the infusion center themselves, all of them, they're great. I consider all of them my friends, the whole staff. I bought them roses one time, brought them in, and just to show my appreciation. One of the nurses back there, Stephanie, her husband plays hockey. I actually brought them a hockey jersey that was very dear to me. It actually says Hockey Doctors on it. It's got a red cross. I signed it with a thank you on it and gave that to them. I just try to give back for what they've all done for me.
This building here, even though now it's Nashville General, I literally grew up in this building. And my father graduated from Harry Hubbard. And I watched this building come up from the foundation. And so the building holds a lot of memories for me, a lot of good memories. And to see that Nashville General is still carrying on the memories, the staff, because the staff that I remember, they are either retired, too old to practice, or they're no longer with us. And to be able to walk in and know that everyone is trying to carry on that tradition makes me feel very, very good.
The 6th floor nurses and doctors there were angels. They just happened to be wearing scrubs and uniforms. But they saved me. They watched over me. They made sure that I got home. And I believed I was going to get home every time they told me that I was going to get home. There was a while when I didn't think that I would, but they reassured me that I was going to get home. And I don't know what else to say because there are no words that I can express that are coming from my heart to say other than I love you. And just like you did anything for me, I would do anything for you. I love this hospital. I love my 614.
My dad, who is D.B. Todd, Dr. Matthew Walker, all the Dr. Browns, Dr. Kermit Brown, all of them. I don't like to call names because I know I'm going to leave out somebody, but to know that their legacy is still roaming through this building is good, it's excellent. I just love being here. And knowing that the staff here is very caring and they're very warm, then that makes all the difference in the world.
Thank you for the opportunity to participate in this town hall. And as the chair of Metro Hospital Authority Board of Directors, I'd like to thank Mayor Cooper and the Metro Council for their leadership and support, the Hospital Authority Board members for their commitment to Nashville General Hospital, the staff and the community that we serve. And I'd like to send a special thanks to all the Nashville General Hospital employees who are tuning in to this virtual event. This pandemic may have prevented us from gathering in person this year, but it hasn't impeded the Hospital Authority Board members from hearing about the wonderful work of our Nashville General Hospital employees despite this very challenging year. Our board is continuously reminded of the phenomenal work you are all doing through the patient lives you have saved and the testimonials of the lives you have all touched with your dedication to quality patient care. As chairwoman of the Hospital Authority Board of Nashville General Hospital, it is my goal and the goal of Dr. Webb to continue to increase the revenue of this hospital, to continue the outstanding employee morale, and to continue to improve patient care, which results in patient satisfaction. The role this hospital plays in the community is unique and very important to the overall health of those living in Davidson and surrounding counties.
I would go so far as to say that Nashville General Hospital is one of the truly essential institutions in our city, even if some segments of our community fail to recognize that role and appreciate every one of you for your part in making Nashville General Hospital instrumental in the health and wellness of the community it serves. That is why we as a board are joining with Nashville General Hospital's executive team and giving some long, hard thought to the future of this institution. Dr. Webb and his team have laid out a 5-year plan for the future of Nashville General, a future that includes an improved hospital facility, new technology, and stronger relationships with our partners in providing the highest quality care for all Nashvillians. Of course, there's still a lot of work that has to be done before that vision can become a reality. The board has asked Dr. Webb and his team to continue with the process of creating a concrete plan that will allow for the goal of an improved hospital facility to come to fruition. We know the lease on our current facility will come to an end in 2027. We also know that it will take a substantial investment to upgrade the current building into the type of hospital our clinical staff and patients need and deserve. Whatever the future holds for Nashville General Hospital, we want it to be done in conjunction with our partners at Meharry Medical College. Our goal for now and the future is for Nashville General to be the index hospital for Meharry and its students. The fiscal challenges currently facing Metro government are significant. The mayor and Metro Council have been forced to make some difficult decisions to keep Metro government operating and our city's economy vibrant. A new and improved Nashville General Hospital, however, does not have to depend on the Metro budget to finance this endeavor. There are creative ways of financing a state-of-the-art hospital, and we will be asking Dr. Webb and his team to explore those options because each and every one of you deserve this, and so does the community that you serve. I know firsthand how well all of you have responded to the demand placed on you as a result of this COVID pandemic. You've heard one of my patients, Donna's COVID-19 testimonial. Donna has commercial health insurance and could have gone anywhere in this city to receive treatment. But after we talked, I told her to go to Nashville General's emergency room because I knew that she would be given the best medical attention, which was what she needed. She has since recovered, but she can't say enough about the level of compassion and care she received from the people she refers to as her sixth-floor angels. There is no doubt in my mind that their caring and positive attitude helped her condition improve during what she admits was a scary time. I know Donna's story is not unique. As a graduate of Meharry Medical College and having completed my residency training in this very same hospital, I know firsthand what Nashville General Hospital has to offer this community. Donna's story helps others to see what I already knew, that Nashville General Hospital is an important part of the healthcare in our city. But we need to help people like Donna spread the word. Every day, there are individual stories from Nashville General Hospital staff and physicians going above and beyond in caring for patients. We need your help in shining a spotlight on the amazing level of care provided at NGH. So tell somebody when your physician, Nashville General Hospital staff member, or even your colleague at NGH does a great job. Tell a manager, tell an executive, tell me. And then we need to tell the community. We need your help in shining a light on the great work being done here and in helping the community understand just why Nashville General Hospital is such a valuable asset. To all the doctors, nurses, staff, and administration at Nashville General, thank you for all you do and for all the lives you've saved and will continue to save. Our future is brighter because of your dedication and hard work. As my patient Donna said when she recounted the great care she was given, it's not the building that makes the hospital, it's the wonderful people that work in it. Be blessed and stay safe.
Officer for Nashville General Hospital. We are doing great things here. I may be biased, but tonight you've heard from a few of our new and long-standing patients who could have gone anywhere to give birth or be treated for cancer, COVID, or heart conditions, but they chose Nashville General and received exceptional care. The future for Nashville General is bright. Nashville's health and wellness is indeed in good hands. We are here for good. Next up is a live question and answer session with Dr. Joseph Webb, Nashville General's Chief Executive Officer, Dr. Shindana Fagans, Chair of the Metro Hospital Authority Board, and a few of our executive team leaders, including Mark Brown, Chief Operations Officer, Dr. Deanne Bullock, Chief Medical Officer, Veronica Elders, Chief Nursing Officer, Dorothy Bennett, Chief Ambulatory Services Officer, Bruce Nearmore, Chief Financial Officer, and Melanie Thomas, Chief Information Officer and moderator for tonight's panel. Melanie?
Thank you, Sherry. I'm going to just jump right in and get started with some questions that we received from our community members via email early on. I'll start with you, Dr. Webb. In the video, you mentioned offering the highest quality of care regardless of the patient's ability to pay. What percentage of Nashville General patients, what percentage of patients that Nashville General serves are uninsured?
Well, thank you for that question, Melanie. Surprisingly, only 35 to 40% of our patients do not have the ability to pay or are considered indigent. The remaining 60 to 65% of our patient population are insured through commercial or other forms of healthcare insurance.
Okay. Bruce, a follow-up to that question would be, so how much of your costs are then in fact covered by Metro?
Yeah, Melanie, in the year that just ended, 2020, the Metro subsidy of $43 million was just less than 40% of our operating budget. So a little less than 40% in the last year. And 3 years ago, it was over 50%. So we've been moving that number down steadily over the last 3 years. The subsidy's actually gone down ratably over the last 4 years. And the more insured patients we bring into the system, the better opportunity we have to continue that progress.
Okay. So I know the questions that are on everyone's mind relate a lot to COVID. So I'm going to go to Dr. Bullock and ask, is Nashville General involved in the vaccine rollout for the general population? Dr. Bullock? Okay, Dorothy, can you talk a little bit about how Nashville General is involved in the vaccine rollout?
So currently, Nashville General is, we've just completed a lot of our employee vaccinations. They were the first ones, the essential employees that we have. And we're just starting this Friday to do vaccinations, COVID vaccinations for our current patients. Keep in mind that we're only allotted so much vaccine from the state. So right now our goal is to get our clinic patients vaccinated. And then as the vaccine is increased, that we get more of an allotment, then we will open that up to other patients. But currently it's only for our current patients.
Dr. Bullock, is there anything else you'd like to share regarding the vaccine rollout? Okay, I think Dr. Bullock is having a little technical difficulties. Veronica, can you speak to how full is Nashville General due to COVID?
Yes, I can, Melanie. Thank you for that question. Today, I'll tell you most of our med-surg beds that are staffed are full. Our emergency department right now is full as most hospitals around the city. We've seen a increased number of patients coming in for care. So our floors right now, we do have a couple of med-surg available beds, but our ICU is full and our emergency department is at capacity at this moment.
Okay. If your emergency department's at capacity and you're really impacted by that, how how else have you been impacted? Have you been impacted by the nursing shortage of COVID during COVID?
Yes, well, what I'll say to that, Melanie, is there's a nursing shortage that has existed nationally for a number of years. I think COVID has exacerbated that shortage. We've had staff illnesses. We've also had staff leave the organization to take higher paying travel nurse positions for crisis pay. But we've really worked really hard to retain and attract staff. We've implemented bonuses for our direct care teams. We've created a crisis nursing staffing pool and also offered incentive pay for our full-time staff to pick up extra shifts. So like many hospitals, I'll say across the nation as well as the city, we are all experiencing the same challenges with nurse staffing right now. That's all I have to add.
Okay. Dorothy, are your nurses experiencing shortages? Are you experiencing the nursing shortage as well in your areas?
We're not. For the clinics, you have to keep in mind that we work 8 to 4:30, no holidays, no weekends. It's an ideal job for a nurse. We don't do the 24 hours a day like Veronica's staff do in the hospital. Our patients, we pretty much know what they're coming in for. So we're pretty well staffed. We've been blessed this year actually to get the additional staff that we have and get some of our positions closed. We were also blessed when the Bordeaux organization closed because we were able to hire some of their very experienced nursing staff. That was important to me and also to our organization, that some of them were very long-term employees. We wanted to make sure that they were able to stay within the metro system. So we hired quite a few of them in the clinics, and I know that they're still interviewing for the other areas. So we're doing pretty well this year.
While we're on the topic of staffing, Brandy Fundecker asked, if working at a county hospital pays the same as any other hospital in Nashville, why would anyone be loyal to them? Veronica, I'm going to field that to you.
Okay, thank you, Melanie, for that question. I think nurses stay or come to our hospital for that community environment. For my nursing division, I'm the CNO, but I know all of their names and they know mine. I visit them regularly. They feel free to come and talk to me about their concerns. You don't see that in the larger chain hospitals. My experience, I worked at one of our close hospitals down the street for about 17 years, and I never really knew who my CNO was or even had the ability to speak to them. And so I think that's what makes us different. We are a family and community environment, and we take care of our employees.
Okay, question from the community. I'm gonna start with you, Dr. Bullock, and probably send it over to Dorothy. Or actually, let me start with Dorothy. Do you think that Nashville General or Nashville Healthcare Center will serve as a site for COVID vaccinations for the general public?
I do think we will eventually, as I said, until the vaccination allotment goes up for our organization. We're getting very few vaccines right now, so we have to take care of our current patients. If and when that vaccine allotment is increased, we will definitely open it up to the public. We served as my staff are out in the community when we were doing the COVID testing, and at many different sites. We're about the community. We want to, and not just our patients, we want to take care of everyone. Our mission is about one neighbor at a time. So as soon as we get the vaccine allotment, we will open it up to the general public.
Thank you, Dorothy. Bruce, we're still on the topic of COVID. Did Nashville General receive any COVID funding, any federal COVID funding?
Melanie, we did. We received 3 separate awards. We didn't apply for any of them, just so everybody understands. We were awarded $830,000 in the first month, that April month, with 2 payments totaling $830,000. Then we received a large payment in late June that was $9.4 million. So in total, $10.2 million was awarded to Nashville General Hospital. The large one was particularly because we are a safety net hospital and because we handle a large proportion of patients that are uninsured. So that's definitely the big one. We didn't apply for them. They were awarded based on an algorithm, based on the amount of care you provide to Medicare patients in the year 2018 cost report. The fact that we had a high number of uninsured patients in our cost report for 2018 is what resulted in the large 9.4 million that only the public hospitals in this state were awarded. So we've been spending those dollars for some of the bonus programs or differentials, hazard pay that we've paid to some of our nursing staff, respiratory staff, people that are really in the trenches. And then to try to retain those staff from being lured away for travel jobs. So thus far through December of 2020, we've actually spent or drawn down 7 million of that $10.2 million to reimburse us for staffing costs, exceptional costs for protective equipment, and pharmaceutical items that are used in direct treatment of COVID patients. So that's where we stand today.
Do you anticipate any additional funding in 2021?
With the new president in, and there is we are understanding that there's a large bill coming out shortly, but I don't know how much that's impacted by the impeachment discussions and so forth. But we do believe that eventually there will be additional dollars forthcoming for all hospitals because the COVID crisis obviously is still going on. If we're approaching spending the majority of ours, I'm pretty sure many of the other hospitals are in the same position where they're starting to get very low on those funds and still have the obligation to take care of patients going forward.
Thank you, Bruce. I'm going to keep it at you for just a second. Can you talk about how many patients we see at Nashville General every year?
Sure. Just ER, ER is the entry point for most of our patients that are actually admitted into the hospital onto the floors. We see about 32,000 patients in the ER a year. It has been a little higher in the past. COVID has obviously convinced a lot of people with low or light acuity issues to stay home or maybe wait to see their doctor the next day. So we've seen a little decline in ER volumes since COVID hit. But ER admissions are continuing to go up, even though the number of visits is down a little bit. Dorothy mentioned in an earlier segment, we're going to be pushing 40,000 clinic visits this year. Those are unique clinic visits. And then, of course, we've got tens of thousands of other outpatient presentations in imaging, the laboratory, and others. So, well over 100,000 visits in total per year in this little safety net hospital. We push a lot of volume through here, insured and uninsured.
Okay, I saw one of the comments in the chat earlier that someone mentioned we need a new hospital. Mark Brown, is Nashville General Hospital moving or are we looking to move?
Well, I'm glad you asked that question, Melanie. Tomorrow, January 27th, would mark our 23rd anniversary of our move from Hermitage Avenue to this Meharry campus. The 30-year lease will be up in 2027. In December 2018, the Hospital Authority Board approved our fiscal year 2019-2020 business plan, which included the approval of a feasibility study of a new facility or to renovate the existing facility. Some of the major factors that we had to take in consideration was it must meet the needs of our current patient population and provide flexibility for future growth, have access to public transportation and at least 40 acres for future growth, maintain our current teaching status as Meharry Medical College's teaching index hospital, and also maintain our affiliation agreements with other schools throughout the region. Our executive team has been working with the city's leadership and our key stakeholders regarding the upcoming lease and possible new location for the hospital. Thank you.
Thank you, Mark. Dr. Webb, what would a new hospital mean to our patients?
State-of-the-art technology, more space, more updated facilities, would very likely generate a larger patient volume, and we would be able to better accommodate that with our capacity. It would allow Meharry to be able to probably expand their recruitment base, because they would be coming to a hospital that would be designed around the teaching capabilities that they desire for their students. So there are all kinds of amenities that would come with a new hospital, and I think the city is very deserving of a public hospital that can stand out and deliver physically what we're already doing here in this smaller campus and allow it to reach its full capacity. So the sky's the limit as to the benefits of a new hospital that would be one that serves this entire population, regardless of their ability to pay.
Thank you. I'm going to move a little bit to the subject of our clinics, Dr. Webb. Can you tell me what it means to be a patient-centered medical home?
You want me to do that?
Yes, I'd like you to start that off, please.
Okay. We come across organizations and hospitals that treat patients, but the patients are treated, from a provider-centric standpoint and not necessarily the patient-centered standpoint. So by being a patient-centered, I mean, that name, that concept really does mean something. It means you focus on the patient's needs first. It means that all of your care is driven based on the evaluation that you derive based on the needs of that patient, and it cares for the whole person, oftentimes referred to as holistic medicine, or the practice of holistic medicine and taking care of the entire individual. So the patient-centered medical home, which is the clinic designation that we have here, has all of its attributes designed around executing on a patient-centered model. So outcomes are better. It's centered around prevention. If we can keep the patient out of the hospital, that is what we do. We have what's known as a care management side of the patient-centered medical home, which focuses on educating the patient and keeping them well. And so for us, that means that the individuals don't spend as many days inside the hospital where the care is more costly. And it's one of the ways that we're able to control our cost and yet get better outcomes. And that's also why you're seeing the tremendous growth of our ambulatory patient volume that will likely exceed 40,000 patients this year.
Dorothy, what does it take to maintain those patient-centered medical home standards and quality?
It takes a lot. It's an everyday endeavor that the staff, the faculty, and I, our providers, work on, because both the chronic care model and the patient-centered medical home are evidence-based models. So the standards are very rigid. Many of them we have to meet. There's over 120 standards, and over half of those, we have to meet those. They're a core requirement, and you can't be accredited if you don't meet that. So we work on a daily basis to make sure that we have clinical practice guidelines in place. We make sure that we're using the national guidelines so that we're doing the same thing that everyone else is doing for their patients. That's very, very important. And Dr. Webb was talking about what it meant to be patient-centered. It's not only about the patient, it's also about their family. We take into consider socioeconomic status. We take into account, are there issues going on in their family that is preventing them from being healthy, keeping themselves healthy with their chronic disease? all of that is completed not only by the provider and the nursing staff, but our care management team, in which we have social workers, we have nurse practitioners, we have a licensed clinical social worker, and we can help them with not only their health care, but things that keep them from being healthy. So it's very, very in depth, and love it. We're seeing amazing outcomes for our patients. And Dr. Webb is right. That's why our volume is going up, because our patients are coming to the clinic, not going to the ER as much and not going into the hospital as much, because we're keeping them healthier. Our outcomes, when you look at the chronic care model, our outcomes are doing great right now. So our goal this year is just to continue that on. We just reposted our accreditation today for our clinics for PCMH through NCQA. That's it's a rigorous endeavor, but we've done it. This is our third application, so I think we're doing a pretty good job at it. And our patients are the winners.
Dr. Fagans, you have had, on the video, one of your patients shared the experience. Are you seeing that consistently throughout your patients that come to the clinics and to the hospital?
Oh, most definitely. I send all of my patients to the hospital if there's in need of emergency care, things like that, or imaging. And so I've got nothing but positive feedback from my patients. They're very pleased with the service that they've gotten, whether it be inpatient or outpatient services. So, and I'm very pleased with that as well.
Thank you, Dr. Fagans. I want to shift a little bit to the money. Bruce, can Nashville General Hospital be self-sufficient without Metro funding?
Melanie, it would take many years. 40% indigent load, 40% indigent load with no reimbursement for those patients. I just don't see it in the next few years. We keep moving the numbers. We've gone from over 50% to less than 40% of our funding provided by Metro. But there are other states that actually fund indigent care. I've worked in Texas and Mississippi, and they actually reimburse hospitals their cost for indigent patients. If we had that arrangement in Tennessee, I do think we could be self-sustaining, but unless the state changed that approach, or we could grow our commercial business, maybe double it, we certainly could start to get close to reducing that subsidy further. That is the goal, to continue to reduce the reliance on that Metro subsidy and forge our own future. So we're making progress. We got a ways to go, though, honestly.
So how much revenue does the hospital generate?
In 2020, the year with COVID, at least where it started, our self-generated revenues dropped from about 43 million to 40 million. This year that we're in right now, 6 months in, we're projecting that we're going to produce 47 or 48 million dollars of patient collections for the work that we do. Then we also draw about 20 million a year from the federal and state government, because we are a safety net hospital. That's a unique feature of this hospital. And then the balance is actually the Metro subsidy. So, the subsidy as a percentage is continuing to go down, but it's still vitally important. It's always the last dollar in for us in our financial program.
Thank you, Bruce.
Mm-hmm.
Mark, do we own, I know you're in charge of the facilities. Do we own this building?
Melanie, we do not own this building. We're actually in a 30-year lease. We're coming up to our 23rd year here. So the lease actually ends in 2027. And at that point, we will have to either renew the lease or be in a new location and a new hospital.
Dr. Bullock, how is your relationship with Meharry?
So we do serve as the index teaching hospital for Meharry Medical College. For many of you who may not know what that means, we actually provide the majority of the teaching for the designated residency services, which include OB, family practice, internal medicine, and psychiatry. We provide their rotations on multiple different services. We have their faculty that are part of the medical staff that provide the day-to-day care for the patients. So there are a lot of pieces that go into that. There's a lot of, we have to really affiliate well with Meharry in order to make sure that the residents get what they need, the faculty gets what they need. It does take a lot of effort. It takes a lot of work. Many are providers who are not directly hired by Meharry are adjunct faculty. We offer that to all of our providers within the organization if they are not hired directly by Meharry. Many people come to our hospital to work specifically for that academic affiliation that we have. So it serves both entities well, and it's a great relationship not only for us and Meharry, but also for the patients that receive the care.
Does anyone else want to comment on the relationship with Meharry? Mark, I know you work a lot considering that our lease is, our building is leased. You want to talk a little bit about that?
Yes, we actually lease the parking garage from Meharry that our patients, physicians, and our staff park in. We lease this building, the space that we're in currently. We pay Meharry for that each year. And we actually, Peter Millett, Dr. Millett and I, who's the executive administrator for Meharry, he and I communicate on a regular basis about things that are throughout either our facilities or the campus-wide in the initiative. So we have a great working relationship, Peter and I, as far as facilities and the campus itself.
And Melanie, I'd like to add a comment about that. You know, it's an additional fulfillment to know that you're working with a historic organization like Meharry to educate and train medical students that are going to go out. Some of them will come back into our own environment, like Dr. Bullock here, like Dr. Fagan, two very prominent Meharry graduates. And, you know, they're all over the country. And to be a part of that legacy and helping to support the training and creating an environment that's conducive to that great scholarly learning that takes place at Meharry is something that is, you know, it's as much a part of the fulfillment as taking care of our patient population, because it's very germane to that.
One other thing on that, Melanie, is when our patients, getting back to our patient focus, when they come into the clinics or into the hospital, they truly don't know which physicians are Meharry physicians or our Nashville General physicians, because we intermingle throughout the clinics and the hospital. So truly patients really don't know the difference.
Okay. Mark, we have other training programs. Can you talk a little bit about our other training programs here at Nashville General Hospital?
Yes, I'll be glad to. Nashville General actually has its own School of Health Sciences. We have a radiologic technology program. That's a 2-year program. Once you graduate, you're able to take the national certification for radiologic technology. We have a CNA program, and then we have a EKG program here at Nashville General that we offer to participants here on campus itself. We also have several didactic programs to get your registry in some of the advanced modalities in imaging, CT, MR, and mammography. We allow for that here as well. We also have other affiliations here. So our school, most people don't know it, but a lot of our students that graduate from our radiologic technology program are employed by most of the employers here in town. Vanderbilt and the VA really corners the market on those students that graduate here from Nashville General Hospital Radiology Technology Program.
Great. I think that we have exhausted all of our online questions. I do want to thank Councilwoman Allen and Councilwoman Porterfield for their questions, as well as all of those who have tuned into to this video portion, to this live portion. I do want to turn it over to Dr. Webb for some closing remarks.
Thank you, Melanie. Excellent work. Wow, it's been a information-filled evening. I hope that you are all able to garner some new insight regarding what Nashville General actually does here in the community. We want to thank you all for being with us tonight. Nashville General Hospital is committed to being your healthcare provider of choice. Our goal is to deliver exceptional healthcare to every patient, regardless of their race, ethnicity, socioeconomic status, or language. And Nashville General Hospital, we're prepared for whatever we face in the year 2021. And I'm proud to say that we will continue to expand our community outreach. We'll also continue to answer the call for excellent healthcare to all Nashvillians. And to the panel, the excellent work that you've done and all of those that participated as a part of this presentation. Thank you all, and thank you all again for being here tonight, and good night.